Okay, so we are officially recording, and I would also like to spotlight Justine Gooden. And just before she begins, and she'll tell you guys a little bit more about herself, but Justine Gooden, no pun intended, she's a good friend of mine. She's such a very loving person. And, normally people speak about what people do, but I'm going to speak about the person herself first. She's very kind. She's very loving. She's like a sister, a baby sister. And I feel the greatest sense of protection over her. And I am honored to have her in my life. And she's very caring. Anytime, you tell her something, like she's actually one of my mentors in nursing. And she probably doesn't know that, but she is a seasoned veteran nurse. And long before I started my profession in nursing, and she is now one of those go-to people, go-to nurses anytime I have a question about nursing. So and so she is a nurse practitioner, a family nurse practitioner. She works um, in a clinical setting with various patients, I believe in the area of endoscopy. She'll tell you guys some more. And God has really and truly used her in a wonderful and marvelous way. She does enjoy everything to do with church. She is a very organized and timely individual. She takes everything very much seriously, but in a good way. Um, she's a disciplined, very organized professional, and I love that about her. And may God be with you tonight, Justine, as you share with us. And if you need anything at all, we're right here. Okay? Okay.
Thank you, Sarah, for that introduction. I wished my my screen was not pinned in that moment when you were talking about me. Good night, everyone.
Good night, my love.
I am going to try and share my screen. I hope everything works smoothly. Unfortunately, I wasn't able to sign on with Sarah beforehand. Okay. Everyone is seeing the screen?
Yes, I could see.
Okay, thank you, thank you. Let's see who has their camera on. Nobody. What am I gonna look at during this whole presentation?
Me.
Okay, so good evening, everyone. Happy Sabbath. I am Justine. Professionally, I've been a registered nurse for a little over 6 years. And more recently, in the last year, I've transitioned to being a nurse practitioner. I currently work in an outpatient setting, as Sarah said, and it's interventional GI. So the providers that I work with, they are not general GI doctors. They do more endoscopic procedures, whether colonoscopies and upper endoscopies, ERCPs. Most procedures are geared to treating the pancreas, the small and large intestines, the bile ducts. And so they cater to doing some sort of intervention endoscopically instead of, going for surgery to remove any lesion or anything that might be concerning. So the topic of gut health has been an interest for me for a long time prior to this new role as an NP. For those who know me, I've always struggled with upper GI symptoms. If I'm gonna have my meal, I'll have a cup of warm water before, because I had really bad upper GI symptoms. And so I felt it was God providence why I ended up being in a specialty that meant so much to me, because myself could relate with my patients. So when they say, oh, I can't sleep because last night my acid reflux was really bad, I could relate to them and understand what they're actually feeling. But I love GI, and I want to continue to grow in that area. So we are God's children, right? And the psalmist says in Psalm 139, verse 14, I will praise thee, for I am fearfully and wonderfully made. Marvelous are thy works, and that my soul knoweth right well. So we are created in God's image, and our body is fearfully and wonderfully made, and it's very complex in the sense that these things that happen, even in just our gastrointestine alone, it points to the fact that we definitely have a creator. And as we go into this program, I hope you may not think that it's a lot of bio, but that you will get the fact that you are wonderfully created by God. And because you are supposed to treat your body accordingly. Okay? And in 1 Corinthians 6, verse 19 to 20, it says, what? Know ye not that your body is a temple of the Holy Ghost, which is in you, which ye have of God, and ye are not your own? For ye are bought with a price. Therefore glorify God in your body and in your spirit, which are God's. So you are God's child, right? And you are supposed to respect your body, you're supposed to love your body, you're supposed to appreciate your body, because life is a gift, right? And a couple of years ago, there was a popular saying, you only live once. And indeed, we have this life, and we were given instructions in the beautiful Bible that tells us how we are supposed to live, and how we're supposed to treat our bodies and treat those around us. And so there's this acronym called God's Plan. And what this acronym does, it has simple steps or simple lifestyle modifications that can have profound effect on our health. And I hope that by the end of this presentation that you are able to at least pinpoint one of these and how it can be beneficial to your health, especially your gut health. And for each of them, there is something that can be done that can help your gut health. So let's do a Bible case study. As nurses, we get case studies so that we could practice and see what's going on and try to, and at the NP level, try to diagnose and figure out how to best treat and plan for this patient. So we're going to turn to our Bibles to 1 Timothy 5, verse 23. 1 Timothy 5, verse 23. So just a backstory for those who may not know who Timothy is. So the book of Timothy was written by Paul, and Paul was like a mentor for Timothy. And so in this letter, he was sharing with Timothy instructions. He left him in Ephesus, and he was giving him guidance. And for some reason in 1 Timothy 5, verse 23, he was giving him some advice on his health. And it reads, if you're there, if you could take a look, it says, drink no longer water, but use a little wine for thy stomach's sake and thine often infirmities. And so Paul was just trying to advise Timothy as to what he could do to help his stomach. And I brought this case study primarily because of two reasons. One, to shed light on the fact that the Bible is practical, right? And just about anything that we experience in our life, if we thoroughly search the scriptures, we can find advice from the Bible. We can find scenarios where people experience something similar to what you're experiencing. And so here we have Timothy. He has some sort of stomach ache or infirmity, and the advice of his mentor or a father-like figure which wouldn't steer him wrong, is to drink wine for his stomach's sake. Now, some may think that the wine mentioned was fermented, but there is many evidence that suggests that it was not fermented. It was regular grape juice. I won't talk on that. I just want to highlight the fact that his mentor gave him advice about a natural way, a natural remedy that can have a profound effect on the body. So I looked up grape juice. So it depends on the type of stomach ailment that that person may have, where the grape juice can be helpful. So I guess in the case of Timothy, whatever he was facing, that grape juice would be beneficial. So grape juice has antioxidant properties, including flavonoids, resveratrol, vitamin C, and these have anti-inflammatory properties that basically can smooth the digestive tract, right? It's means of a protective property for mild irritation, so it depends. And then grape juice also has natural sugars, which is a quick source of energy. So maybe with this ailment, Timothy needed a source of energy, right? And this is a natural sugar in the grape juice. It also can act as a mild laxative. Maybe he had some motility issues, like probably constipation. And so grape juice can be beneficial for that. Also, grape juice has potassium, which is a good source of electrolyte, and it can be helpful for people who have vomiting. So we're not sure exactly what type of stomach ailment that he had, but this natural remedy was shared with him so that it could be of benefit to him. And I just wanted to shed light on the fact that the Bible has so many beautiful real life stories that can be applied to our lives today. So my question to you is, what is gut health? I am in need of hearing someone's voice. So without reading on this, what's on the screen, what's gut health to you? Anyone?
Having and being able to enjoy and digest food without any discomfort.
Thank you. Anyone else?
The ability for your gastrointestinal system to function at its optimal capacity without disease and any feelings of adversity physiologically.
Okay. So both sound good. Did I do something wrong? Is there a way for my face to be on the screen as well, Sarah?
I see both of you, and your slide.
Oh, so maybe I'm not seeing it.
Maybe okay. You have a black background now.
Is it
Oh,
showing?
like that. Yeah, perfect. That's great. Yeah.
I think I messed up, but it's okay.
No, this is so much better. This is really cool.
On your end, perfect, but I'm just seeing the plain slide. All right, so thank you both for sharing. And what I found was gut health refers to the overall health of your digestive system, which includes the balance of bacteria and yeast in your gut and how well your body digests food and absorbs nutrients. Gut health is important because it can impact your overall health and well-being, right?
Yeah.
So you have good gut health, and if you have a good, you must have a bad, right? So gut health sounds like what Sarah, and I'm not sure who else was speaking, was saying. But here are some examples of what to look for to know if you have good gut health. So regular bowel movement pattern. Some people, they have 3 times daily. Like some people would tell you that you should have a bowel movement after you have a meal, right? That's optimum gut health. While others, for some reason, based on their motility, we don't know what's going on, but they have a bowel movement like every other day. But for good gut health, we would say at least 3 times weekly or up to 3 times daily, right? You're passing healthy stool. The consistency and color smooth in one piece or smaller pieces that sinks to the bottom of the toilet. So for anyone that knows me, like, to be talking about, like, you know, passing stool, etc., they would be like, they would never hear me like talk about that, about myself. But for me and my patients, we sit and talk about this all day. They'll be telling me, oh, it's greasy, it's floating at the top. And once you're seeing that, you think of like a pancreatic issue. There's some issue with absorption, or the bowel juices coming out with the stool instead of absorbing the proper nutrients. And another sign of good gut health is you have a good transit time. Now, the place where I got this from, it says a good transit time is 28 hours. And you need to have a good transit time, because if the food does not flow throughout your stomach properly, then you can have motility issue. And you'll probably, like, when you eat, you're feeling full quickly. That's not a good sign, because it means that you are having early satiety, the food is stuck in your stomach, and maybe the sphincter at the bottom of the stomach, to the left, you see a picture of the stomach. That section that leads into the small intestine, that might either be too tight, so the food is not is not moving as it should, and so it affects the transit time. So you want to make sure the food is not going through your stomach too fast, because you don't want to have dumping syndrome. Sorry. And then you don't want it to go too slow, because then you have the food being stuck inside. Sorry, it's messing up. Are you still seeing the slides?
Yes.
Okay. So another reason, a sign of good gut health, is you don't feel any discomfort during bowel movement, right? You're not having any pain. But some people, they might have a pain right before the bowel movement, and then after the bowel movement, the pain is gone. So that could be a sign of IBS, or it could be a sign of constipation. So you should not be having any pain either during, before, or after the bowel movement. And lastly, you're not bloated. If you're bloated, could be a number of reasons, but it could be some pancreatic issue going on as well. So now we have poor gut health, which is all the stuff that nobody wants: gas, bloating, constipation, diarrhea, sleep disturbances, right? Your gut health can even affect your sleep. Then you also have sorry, this slide is, you also have fatigue, and the big one, mood changes, which is a perfect segue into what we're going to be talking about next, about our mood changes and our gut. So have you ever heard the expression that the gut is the second brain? Anyone has heard that before?
Yes.
Okay, good. So more recently, they're suggesting that the gut is the second brain. Have you ever heard the expression "go with your gut"? As if your gut can tell you exactly what to do. Or if you have butterflies, then yes, you like this guy. And if there's any guy here, yes, you like this girl. So people often consider the gut as a second brain. And so in this study, I believe with John Hopkins, they've come to realize that the understanding of the link between the brain and the gut is revolutionizing medicine. Like, there's a link between digestion, mood, health, and even the way you think. So scientists call this the enteric nervous system. And this system It is made up of more than 100 million nerve cells lining the gastrointestinal tract from the esophagus all the way to the rectum. Over 100 million nerve cells. Its main role is controlling digestion, from swallowing to release of enzymes to break down food, to control of the blood flow that helps with nutrients absorption and elimination. And here's the big thing, right? The enteric nervous system may trigger big emotional shifts experienced by people coping with irritable bowel syndrome and functional bowel problems such as constipation, diarrhea, bloating, pain, stomach upset. So they're saying that this have an effect on our emotions. For decades, researchers tend to think that anxiety and depression is what triggers someone to have those GI upset issues. But now they're saying the same can be said the other way around, where when your stomach becomes irritated, right, your central nervous system is affected, and now you're having mood changes. So now you're sad, cranky, anxious. For all the ladies here, at least once a month, we all go through mood changes because of our hormones, right? And now to hear that the stuff that I eat can irritate my stomach in such a way that it affects my mood. Like, how much more can we take? And so we have to be mindful of what we actually put in our body. Because can you imagine, right? Let's all turn to Galatians 5:22 to 23. Can you imagine someone with mood changes doing this? But the fruit of the Spirit is love, joy, peace, long-suffering, gentleness, goodness, faith, meekness, temperance. Against such there is no law. Can you imagine someone who is irritable, right? And I'm not talking about those who necessarily have significant mental health disorders like bipolar and depression and even anxiety, like severe anxiety, right? We're just referring to those individuals who, with poor choices of in their diet or in what they do to their bodies, it caused this trigger from the GI tract to affect their moods. And for some people, we have to remember that we are on the only Jesus that they will meet. Like, our life should be a ministry. And so therefore, we have to be mindful of how we treat this body, because the simplest of things can affect us. Also, gastroenterologists may prescribe antidepressants for IBS. So I've seen this where we have a patient that on imaging, there's nothing wrong. On lab work, there's nothing wrong, but yet they're having excruciating pain. They're having all the symptoms of GI upset. And the next step is to give them an antidepressant. And when they do get that antidepressant, this is just to prove the point of the connection with the brain and the gut. When they get that antidepressant, for example, amitriptyline, right? When they get that antidepressant, it starts helping their symptoms, and they're like, oh, the pain is getting better, and they're feeling better, they're able to sleep, etc. So there is definitely a connection between the brain and the gut. Psychological interventions such as cognitive behavioral therapy may also help to improve communications between the brain and the gut. So for those who do therapy, that is a means, based on research, of helping that brain and gut to connect. So now we're going to talk about factors affecting gut health. And throughout the presentation, you'll see these main factors. You have poor nutrition, lack of sleep. The amount of sleep that you get is vital, even for your gut health. Stress. Remember, we just talked about mood changes, being overwhelmed with different things in life. Smoking has an effect on just about anything. Smoking make worse. And drinking alcohol, there's many articles. You have some, of course, which will talk about the same anti-inflammatory properties have good effect in the system. But then there are articles that suggest that there is no safe limit for which you should drink. There's no benefit whatsoever on alcohol to the body. And these are the top 5 things that definitely can affect gut health. So when I was asked to do this presentation, Sarah wanted me to zone in on one main issue that for as it relates to gut health. And when I was thinking about doing the presentation, what came to mind was acid reflux. And I believe just about anyone here knows someone, if not themselves, that has suffered from some sort of acid reflux or indigestion. And I just wanted to shed light on it. And I hope that when you finish listening to this presentation, that you'll realize that this can be very serious in the long run, if not treated and catered to properly. But also the simple things of lifestyle changing, back to that God's plan that I started out with, can help to take care of acid reflux. So acid reflux, by definition, occurs when there's a flow of stomach contents back into the esophagus. So on the screen, the pinkish color, as you may know, is the esophagus. And we're going to talk about the pathophysiology as to what really happens, why that stomach content is going back into the esophagus. And this can range from mild discomfort. For some people, they may have mild discomfort. And for some people, they might have more severe complications, right? But this is very common because the prevalence in the US is up to 20%. It is considered GERD when it becomes chronic. So you're having these symptoms at least 2 times for the week and over an extended period of time. So let's talk about the pathophysiology of GERD. And look how beautiful our body is. So on the screen, you see 2 stomachs, one that is healthy and one in which that person is experiencing GERD. So in a healthy person, the lower esophageal sphincter, which is where the blue arrow is pointing, right? It's a high pressure zone. Technically, that area, right? It should only relax at specific points. And that specific point is when you're eating. It relaxes, opens, and the food comes down and then it closes. However, in persons with GERD, that transient relaxation of the lower esophageal sphincter is frequent and is not triggered by swallowing. So now there is like a disconnect. And this looseness or frequent relaxation, it can be caused by a number of things. Sometimes they don't really know why it happens, but sometimes they're able to indicate as to why. So I wanted to shed light on hiatal hernias and what is called, in this picture is the bottom picture to the right of your screen is an example of achalasia. And so when patients do endoscopy, sometimes you can find that they have a hiatal hernia, right? And a hiatal hernia is basically when the stomach pushes through the diaphragm, as you can see on the picture, and it through a small opening called the hiatus. And because of this, patients may have symptoms of acid reflux, because remember, that's where the sphincter is. And if anything is preventing that sphincter from closing properly and relaxing when it should, it's gonna have that backflow of food contents into the esophagus. Now, achalasia is somewhat different. it's a whole different disorder than GERD, but the symptoms that occur, it can cause similar symptoms like GERD. So this is where now the lower esophageal sphincter, now it's too tight. So the food is not flowing into the stomach as it should. And so you're having that reflux symptoms, but it's not really acid reflux. It's a whole other ballgame. So that's why we have to ascertain the cause. We have to know exactly what is causing this reflux symptom. And therefore, it's important to be able to monitor your symptoms and seek help whenever you're having these symptoms, because you may think it's simply GERD or acid reflux when it could be a whole physiological process that's going on, whether it's related to any esophageal motility. There's so many things that could be going on. But if you notice that you've implemented the lifestyle changes, which we'll discuss in the end, and the benefits are not significant as you hope it would be, then definitely you should always seek medical help. Maybe you need a scope to find out exactly what is going on. Are we all here? I hope I didn't turn into a bio class.
I'm here. I don't know about everybody else, but this to be.
Okay, so here are the factors that we want to highlight, right? So remember, the baseline that we should think of is that this sphincter is relaxing when it's not supposed to relax. That's what we're dealing with. We know that many other things can cause reflux symptoms, but we're focusing on the fact that this sphincter, it's not relaxing, it's relaxing too much. So contributing factors, if you overeat, consuming large meals can put pressure on the lower esophageal sphincter. Certain foods. Some of us love spicy food, and that can cause the esophageal sphincter to relax and get loose, weaken over time, right? Chocolate, fatty foods, fried foods, citrus fruits, onions, tomatoes, garlic, caffeinated beverages, whether coffee or anything that has caffeine, certain teas, carbonate drinks can trigger effects on the lower esophageal sphincter. And we don't want this muscle to get weakened, because if it gets weakened, then we're going to have acid reflux symptoms. Obesity. The thing is, when there's excess abdominal fat, it increases pressure in the stomach. And remember, I spoke to you about hiatal hernia, when the stomach pushes up in that tiny section in the diaphragm. One of the contributing factors that causes hiatal hernia is when someone is overweight, because that pressure pushes on the diaphragm, and as a result, we can have hiatal hernias. So we have pregnancy as a contributing factor. We know hormonal changes always causing some problems, but the pressure of growing a baby, because remember, the baby is getting bigger and bigger, and it pushes up on the diaphragm and the stomach, the whole anatomy changes. So that could be a contributing factor. Smoking and alcohol both weakens the lower esophageal sphincter, and also it not only weakens the sphincter, but it increases production of acid. And then we have medications. So if none of those apply to you, right? You're not overeating, you're staying away from certain food, you're not obese, you're not pregnant, you're not smoking and drinking alcohol, then maybe you need to look in your medicine cabinet and see, am I taking something that could be triggering me to have acid reflux? And some of those medications include NSAIDs. Now, NSAIDs are considered our Advils, Motrin, can't think of any, Aleve, all of those non-steroidal anti-inflammatory. Those are what can cause reflux to be worse. Muscle relaxant, certain blood pressure medication, I believe calcium channel blockers can cause that to be worse. So now here are the symptoms of GERD. So this is how you find out if you have acid reflux, or if it's very chronic, then GERD. So you have heartburn, which is this burning sensation in the chest or throat. The throat that one can make you feel like you're coming down with a flu, and then you realize 3 days later you're still having that sensation. You're not coughing up phlegm, you just have this dry cough. It might be acid reflux. If you notice any changes in your there you have chronic cough or a sore throat, and there's no respiratory explanation whatsoever, it could be acid reflux or GERD. Regurgitation. So when you eat, there's this bitter tasting acid backing up in the back of your throat. Dysphagia, which is difficulty swallowing, or a sensation like a globus sensation, like food is being stuck. Chest pain. Now, some people may think that they're having a heart attack, right? When they have, it could be that bad. So the first thing they do when you go to the emergency room and you're complaining of this pain, they always rule out any cardiac connection. And once they rule that out, they'll probably give you a cocktail with Pepsid and some other stuff, because it's more than likely acid reflux. But they always rule out a cardiac this disorder, just because it can mimic that of a heart attack. Nausea, you feeling nauseous after eating. It could be nothing that is even spicy or anything triggering, but you're having this nausea. And then of course we have bloating and the burping, which can be very uncomfortable. So some complications of GERD, which might be repeated in this slide. We have esophagitis, Barrett's esophagus, esophageal strictures, and chronic respiratory issues. So esophagitis, I want to shed a light on this. So you have non-erosive reflux disease, meaning, okay, you go to your doctor, you're having acid reflux symptoms, and then they said, okay, let's do an EGD. And when they do the EGD, they see nothing that's like showing any sign of severe inflammation, right? So it may not show in the lining, but yet you're having these symptoms. And then of course you have erosive esophagitis, which can lead to other complications. And then we have Barrett's esophagus, which is basically when the cells in your stomach, because they're used to have, the cells in the stomach are supposed to have able to resist the acid, right? But when those cells are formed in the esophageal lining, that predisposes someone, that can be caused because of the acid coming up in the esophagus, right? One. So the cells are changing and they are abnormal because they're not supposed to be there. That type of cell is not supposed to be there. It's supposed to be in the stomach. And that can predispose someone to cancer. Now, Barrett's esophagus, through research and over time, mostly white males that are bigger tend to succumb to this. Not saying that anybody else can't have it, but it's common in that population. Esophageal strictures, over time, scar tissue from the acid damage can cause narrowing to the esophagus, leading to swallowing difficulties, right? And we spoke about a swallowing difficulty before, achalasia. And then chronic respiratory issues, acid entering into the airways can trigger asthma-like symptoms or worsen existing asthma. So now we're going to talk a little bit about diagnosing acid GERD. So you have upper endoscopy, which is when they put the scope inside and they take a look around and take biopsies, and your biopsies may say chronic inflammation. And one thing I should note is H. pylori can be found, which can be related to that acid content. And H. pylori can be very serious because if it's not treated, some people are symptomatic, some people are asymptomatic. It can lead to ulcers, and ulcers can lead to cancer. We have esophageal pH monitoring, EGD with Bravo, which those two are very important in telling if someone's reflux symptoms is related to the acid content or not. So for example, the EGD with Bravo, they insert a capsule with the endoscopy, and you go home with this monitor, and you're supposed to document like whenever you have reflux symptoms. So at this point, you cannot be on any Prilosec or Pepcid or anything that you may use over the counter, right? You have to be free from that for at least 2 to 3 weeks, because they want to get a true reading if acid is the problem or if it is something else that's going on. And it's for 96 hours, and you monitor your symptoms, you send it back to the facility, and then you have a specialist that reads this and determine, hey, it's an acid issue. Sometimes it may come back, even though you have those reflux symptoms, and they're like, look, it's functional, it's hypersensitivity that you're having. It's not an acid problem. Barium swallow is when you drink, and they'll probably do something like a esophagram and check how you swallow. The esophageal manometry is when they put another scope and they tell you to swallow while laying down, swallow while sitting up. Different forms of do a sharp swallow, do a regular swallow, and it's trying to see if there is any esophageal motility issue, and in turn they could find out if acid is a problem or not. Okay. And now they have endoscopic or surgical treatment. Given that I work in interventional GI office, they do procedures like stretta or fundoplication, basically to try and cure the acid reflux by wrapping the stomach around the lower esophageal to tighten the LES. And everything is done through the mouth, so you don't leave with any surgical scar, etc. The LINX device, I don't think we do that endoscopically. I think we send people to the surgeon, and it's basically a ring or magnet bead that's placed around that same lower esophageal sphincter to strengthen the valve to prevent the reflux. So basically the whole point is you're trying to get that lower esophageal sphincter to work the way it should, instead of relaxing all the time, to relax only when you're stimulating it with the food, when you're swallowing. And the complications. So it's important to highlight these complications because they can be very uncomfortable, they can be detrimental. For example, if you have esophageal ulcers, it can lead to bleeding. So you may go to the bathroom and you may see black stools. We always ask, is it black like my pants? Like, what color is it? You may see bleeding, depends on the color. It tells where in the GI tract the blood is coming from. If it's black, then it's upper GI. If it's more so red, bright red, it could be related to hemorrhoids, etc. But once you see that it's black, just know it's somewhere up in the upper GI that's probably bleeding. Barrett's esophagus we spoke about before, and that would require you to monitor their procedures that they use to take care of this area, and you would have to do different screening. And esophageal cancers, their surgery, endoscopic procedure based on the size, and then eventually if whatever type of treatment plan that you prefer. But all of this being said is, if acid reflux is not taken care of or taken seriously, it may not result into any of these right away, but the possibility of over time, if that area is being inflamed and irritated over and over, and you have severe acid reflux, over time you can damage your stomach lining. And once you develop an ulcer, you would need some sort of treatment to help that ulcer to heal and prevent anything from going to the point where you develop any changes in the cells forming Barrett's esophagus or esophageal cancer. So let's talk about lifestyle modification. So one, eat smaller meals and slowly. For some people, it might be very hard to eat slowly. But it's important to eat smaller meals. And if you notice that you have any symptoms like that, just try to adapt these simple steps. And think about that lower esophageal sphincter. You need to give it time to relax, get the meal closed, and the stomach can work on the food. Avoid food triggers. If you know that spicy food causes you to have symptoms, stay away from spicy food. Stay away from citrusy food if you notice that it gives you acid reflux. Even coffee, stay away from that because you know it will give you those reflux symptoms. Don't lie down immediately. So one thing that we always share is when you eat, what time is your last meal for the day? And after we find out that, then what time are you going to bed? And then after we ask that question, the next question is, are you snacking in between? Because someone might say, oh, my last meal for the day is 7 o'clock. But then you go to bed, say 12, but then at 11 o'clock, you're snacking. And so when you lay down to rest, your stomach is working on that food, and then that lower esophageal sphincter, because you're in a supine position, it relaxes, right? And as a result, that food content, which is not digested, right? Because you need to give your food time to digest, it starts spilling back up. Elevate the head of your bed, maintain a healthy weight. Remember, we spoke about the diaphragm. We want to make sure that there's not too much pressure on the diaphragm. And then quit smoking and alcohol. There's no benefit whatsoever there, and only make things worse regarding your blood vessels, etc. Now, medications. So medications, they have several medications that can be beneficial to acid reflux. But if you can maintain with lifestyle changes, why not? Before you head to medications, unless there's a case where nothing is, it's hard to alleviate those symptoms. But I wouldn't jump to medications right away unless it's like an acute setting. So for example, that person with the heartburn or the chest pain that feels like a heart attack, right? Then definitely in that acute setting, they need something to help them, and they may probably go to if they don't know any natural remedies, they probably go to the emergency room. But the medications, as the side effects of them over long period, there are research studies that show, especially PPIs, proton pump inhibitors like Prilosec, omeprazole, there are side effects of those medication. They have new medication that is out. I think that has to do with potassium, but I'm not familiar with how they work. But in cases though, where patients have like Barrett's esophagus, if they are not maintaining a healthy lifestyle, because remember, Barrett's esophagus is a trigger for cancer, right? Like you can have high-grade dysplasia, and the next, because there are different stages. Whenever they do the biopsy, they have to check what level of dysplasia it is. And it really predisposes someone for cancer. And those patients often, they have to be on proton pump inhibitors. They have to be on it because they have to regulate that acid. So that's why it goes back to lifestyle modifications, because if your prevention is always better than cure. Because if you're at the point now where you have this precancerous or this condition that predisposes you to cancer, it's very hard for you to maintain or to prevent you from going over the edge. So my question to everyone, based on the bio lesson that you just had, is GERD preventable? Anybody?
Yes.
Yes, it is. And that is because of different lifestyle changes that you can implement. And if you're struggling with it, it takes time. But when you do implement those changes and you're like, oh, wow, it's been a whole week and I didn't have those symptoms. Trust me, I can attest to it. but it is definitely preventable through lifestyle changes. So we're back to the acronym. God's plan, godly trust. So when I think of godly trust, the first scripture that comes to mind is Proverbs 3, verse 5 and 6, which happens to be my favorite, right? And we can turn there. And I will read it for you. Proverbs 3, verse 5 and 6. Trust in the Lord with all thine heart and lean not unto your
Oh, you leaving?
understanding.
Okay, see you guys. Okay, take care, Giselle.
In all thy ways acknowledge him, and he shall direct thy path. So when I think of godly trust, I think of having that refuge, having my Heavenly Father to lean on, right? Especially where in this life there is so much stressors. And now we've come to find out tonight that there is a connection with the brain and the gut. And imagine if I'm under stress, that's gonna make my gut health be poor, right? Because I'm gonna be consumed with either being overwhelmed or anxiety, and then all of a sudden I'm either having stomach aches, or it can even trigger your acid reflux to be worse, or even diarrhea, etc. So having that confidence in who God is and his role in your life can help you to counteract the different stressors of life. And the Bible says in Philippians 4, verse 6, and I'll turn there for you. Philippians 4, verse 6, and it says, be careful for nothing, but in everything by prayer and supplication, with thanksgiving, let your requests be known unto God. So that is the foundation, right? The foundation of it all is knowing that you have an Heavenly Father that loves you so much that he's given you this beautiful book, the Bible, that tells you how you are to treat your body, how you are to live with your fellow mankind, with your friends, your family, right? And the simple things that he has given us, it is for our own good, and we should strive to be obedient to them, even with the things that we even being stressed out. He says, cast all your cares upon him, right? He doesn't want you to be stressful, to be stressed, because guess what? He knows the effect it will have on your body. He knows that one, stress is not good for the mind, is not good for the gut, and it can even pull you away from him. So whenever you feel stressed, you're supposed to draw even closer to him. So open air. We may think, how can open air be helpful to my gut? Proper breathing soothes the nerves, right? It stimulates good appetite, and it renders perfect digestion. We think of exercise. Um, there's something that is often considered a digestive walk, which is basically after you finish eating, then for about 15 minutes to 30 minutes, you take a walk, which helps with circulation, right? And while it's helping with circulation and your stomach is working on the food, it also can lower your blood sugar. And in turn, that helps with digestion as well. Now we think of sunshine. I'm sorry, it's not there. Sunshine. How can sunshine promote good gut health? It promotes good gut health by helping with vitamin D production, which boosts circulation, because remember we learned about 100 million, over 100 million nerves in the GI tract, right? But also there are blood vessels there. And so we need that vitamin D to help with that circulation and reducing inflammation in the body. In the gut, you have people that suffer from inflammatory diseases in the GI tract, and adequate sunshine can be helpful with that. Then we have proper rest, right? The stomach needs to rest. I've seen somewhere where it says the stomach needs to rest for at least 5 hours in between meals, right? And that is very vital so that it can give it time to prepare for when the next meal is. And then we think about lots of water. So now we don't want to eat and drink, which we can talk about at another time, but we need to have adequate water, but not with the meals. So you should eat slowly, and then because you don't want that water to wash, basically dilute the nutrients per se. All right, and it can make the food harder to digest when you combine not only water or any form of juice or liquid with the food at the same time. It makes digestion harder. And always temperate. I think that speaks of itself when we talk about always being temperate, because we don't want to overeat, because as we learned, overeating can trigger that lower esophageal sphincter to weaken and be relaxing when it's not supposed to be relaxing because the stomach is so full, right? And nutrition, which I won't go into detail, but I've highlighted a good amount of type of food that we should stay away from, like high fatty foods, fast food. We spoke about caffeine. And optimally, we are supposed to have the Eden diet, right? Remember, when God created us, as I said, the Bible tells us exactly what we're supposed to do for optimum health. And we have that beautiful story of the Hebrew boys when basically they purposed in their hearts not to eat what the king wanted them to eat. So and instead they had grains, right? So it's very important that you are mindful as to what you put in your body, because it can have an adverse effect on your stomach. And we've also learned that the stomach is the second brain. So in conclusion, acid reflux is a common but manageable condition. When acid reflux becomes chronic, it is considered to be GERD. Most people can control symptoms with lifestyle changes and medication, but persistent or severe cases may require further medical evaluation or surgical interventions. Proper management is crucial to prevent long-term complications. And I hope that you leave remembering lifestyle changes. Prevention is better than cure. And 3 John 1 verse 2 says, Beloved, I wish above all things that thou mayest prosper and be in health, even as thy soul prospereth. So God has highlighted set instructions for us to follow. And if we do follow them, we can have that optimum health, because here he says he wish above all things, right? That we will not only prosper, but be in health. And that's it for our presentation this evening. Sarah?